I really wish I had some good news to start off the newscast tonight, but I'm sorry, there just isn't any. We're still in the throes of the pandemic, of course, and now even the glimmer of hope of vaccines is a bit dimmer. The federal government has announced shipments of the Pfizer-BioNTech vaccine will be reduced by 50% over the next 4 weeks. It's one of the two vaccines being given to Canadians right now. The problem is a shortage of vaccine being produced at Pfizer's manufacturing facility in Belgium, where Canada gets its doses. Pfizer, the government says, is pausing some production lines there so it can expand long-term manufacturing capacity. The biggest impact on Canada will be January 25th. Its hope shipments will then be back on track by the end of February.
This does not impact our goal to have enough vaccines available by September for every Canadian who wants one.
It does mean vaccine rollout, already slow, will get even slower in the weeks ahead. At the same time, new projections are out today that paint a grim picture of the trajectory of this second wave in Canada. At current infection rates, we're likely to see an increase of more than 200,000 new cases of COVID-19 over the next 9 days, and roughly 2,000 more Canadians could die. That would push the death toll to 20,000 in Canada. The global death toll hit another milestone today, surpassing 2 million. On top of all this, new, faster-spreading variants are now being detected in multiple countries, including in Canada. It's not believed they lead to more severe illness, but they are much more contagious, and case counts could skyrocket in ways the health system is simply not prepared for. Mike Drolet has our top story tonight.
2 weeks into the new year, a dire warning from Canada's top doctor. Follow public health protocols or even darker days are ahead.
Because in so many areas of the country, the virus is spreading in the community. The moment that you lift some of those, or increase contacts basically for individuals, it's expected that the virus will surge.
The latest projections show a surge to 10,000 cases a day, even if we maintain the status quo. An increase in community contacts could see the caseload rise above 30,000 per day. The only avenue to a decrease is if Canadians heed the warnings.
I know this isn't how you wanted to start the new year. It probably feels like a deja vu all over again from 2020. This won't last forever. But for now, we have to buckle down.
Looking at the numbers, the growth of the second wave is showing no signs of slowing down, with an average of 7,900 new cases per day, which is 4 times as many as the peak in the first wave. And the number of Canadians dying from COVID-19 continues to rise as well. It's expected to soon surpass the peak from the spring, when healthcare professionals were still trying to understand the virus. And that's troubling for doctors who worry they'll soon have to make impossible choices about who they try to save.
The healthcare system underwrites so much more, the economy, businesses, jobs, etc. So we really have not got a true sense of the chaos that would result if we allow that to happen.
Prime Minister Justin Trudeau says he's considering new restrictions, including potentially banning flights from some countries. But he says it's up to the provinces to create COVID protocols that work for them, and he implores Canadians to follow them. Mike Drolet, Global News, Toronto.